Hey YouTube, this is CanPCJPEG, and today I wanted to talk to you a little bit about the Band-Aids portion of the beans, bullets, and Band-Aids. Want to show you not only what stuff I have, what stuff I recommend, and I also want to cover a couple of things that I'd like to add to my supplies yet too. So anyway, let's get started with a little run through of what I've got here as far as medical supplies. I'm not going to hit on everything, but just a quick run through. We've got some over-the-counter medicines, things like Zyrtec, and everything's generic, by the way. I'm a big believer in generics, so um, I may use the trade name, but it's all generic. So anyway, we got some over-the-counter medicines. I got a little bag there of just a few little things. That's something from a smaller kit that I just threw in here for the time being. Ice pack, gauze. Gauze is something that you can't ever have enough gauze, I think. Some iodine, some different tape. I'm a big fan of this stuff here. It's kind of like a spongy, flexible stuff that sticks to itself but not to skin. That's really cool for wrapping arms and legs, that sort of thing. It's really comfortable to wear. It just works good. Got ace wraps, some gloves, just small gloves here, some N95 masks. Um, this is kind of like my little kit with, the most of my stuff, but then I've got some overflow too. So these are just some wipes, band-aids, burn gel, some disposable scalpels, suture kits, and some minor surgical instruments there. And of course, here's a big one, triple antibiotic ointment. I definitely think I need more of this stuff. A cut that gets infected is going to be one of those things that, while it's not a big deal now, um, you know, post end of the world as we know it, that's the type of thing that's going to kill you. So um, can't stress that enough. One quick thing I wanted to mention: the minor surgery stuff, the suture kits and that sort of thing. I don't know how to suture, and I would hate to attempt to. Luckily, my mom is a nurse practitioner, and hopefully she can, will be around to do some of that stuff if need be. And really, what I should do is maybe see if she'd give me some lessons just in case. Um, Moving along, here's some overflow stuff I don't have organized well at all. Just some more over-the-counter medicines and some generic band-aids. And these are some oral airways. I used to be an EMT back in the day, just an EMT basic, but that's something that I'm familiar with the use of. And as far as medical emergencies go, it's ABCs, airway, breathing, circulation. So I wanted to have something for the airway. One of the things I'd like to add later on is a bag valve mask. Um, just something to kind of consider, just kind of thinking, in the future. So some more masks. We've got a whole box of these things. So have a few in the little tackle box kit, but the rest of the box, of course. And I didn't pull out all these. I've got a couple more bottles, but just some rubbing alcohol and hydrogen peroxide. Some handy stuff. Once again, keeping the infection at bay, because I think that's probably going to be one of the bigger things to worry about. Pocket mask for CPR. Some more, let's see, that's triple antibiotic ointment, little packet. Some more generic medicines, some gauze, more ace wraps. These are really cool. These are padded aluminum splints. I call them Sam splints. That's what I learned that they were called. Basically, they're just padded aluminum that that it flexes and bends, and you can bend it around a limb to splint it, and it gets rigid when you bend it. Really cool, handy stuff. You could cut it. That's of course what the trauma shears come in handy for. Number of uses. But that's some good stuff there. And then of course just some more Curlex. Um, Once again, just some basic stuff, I guess, for the most part anyway. Really, what I'd like to get yet in the future, not only some antibiotics. I need to kind of look into that. I know that there's, options of, finding the veterinary equivalent, but that to me doesn't sound too appetizing. I guess what I really should look into is talking to my doctor about doing a prescription for antibiotics, just in case antibiotics, I guess. I know some do. It's not a real common thing, but Anyway, just wanted to give you a quick little run through there. If you have any suggestions to add, please leave a comment. Let me know. Yeah, just let me know what you think. So, well, thanks for watching. Have a good one.